Gonna start the recording and then share my screen. There we go. All right, top of the hour. Let me welcome folks. And if you see folks in the waiting room throughout, certainly let them join us here today. Admit. Welcome everyone. Thank you so much for joining us here this afternoon, this evening, wherever you are here tonight. We are so delighted to have you join us here. I think as a note, I think everyone's going to come in muted, and certainly utilize the chat as any questions or thoughts or ideas pop up. We are recording this session as a note, so if you have any concerns about being recorded, I apologize. Let us know, but please know that this will be recorded, this session. And without further ado, I want to be cognizant of everyone's time here this evening. We are going to be discussing race and health and medical education, thinking about inclusive approaches to teaching and learning. And we've got a fantastic panel of folks here this evening from a number of great organizations that LabXchange works with. And so I will let them introduce themselves as they will this evening. So how this panel will work, each presenter will have about 5-7 minutes or so, give or take, to talk about what their organization does, some key points and some approaches or resources that they have. And then we'll open it up to conversation in the chat. So certainly get your brain thinking, get your brain going and thinking about some great questions for this wonderful panel that we have here tonight. Let me stop sharing my screen, and I believe Marcelo from Body Scientific is going to kick us off.
Hey, thank you, Nicole. Let me share my screen here and just let me know when it comes up. It looks good.
Looks great.
Okay, and I don't know if anybody sees these admit things coming up, but I'll keep clicking on them as we go. Yeah, well, thank you for having me join this panel. I'm really excited to be here to talk about this topic. My name's Marcelo Oliver, and I am president and founder of Body Scientific. I am a medical illustrator. I graduated from University of Michigan in 1992, and I have 30 plus years of experience translating these complexities of the human body into engaging educational visuals. Recently, I was treasurer and board member of the Association of Medical Illustrators from 2018 to 2024, and I'm also on the advisory committee for the Biomedical Visualization Program at the University of Michigan or Illinois in Chicago. I just wanted to share this really quick with the group because looking back in 1993, just when I graduated from my master's program, I was hired to do illustrations for this Black Health Library Guide series that was coming out. It was the first books published, written, and illustrated specifically to address health issues in African Americans. As I look back, after working on this project at the time, it didn't probably impact me as much as I thought. But now looking back, this has really kind of been like part of a steering force in my career as I went forward as a professional doing more of this type of work. Body Scientific's been around since 2005, and during that time, we've done over 30,000 illustrations that have been in lots of publications. We've won some awards for those publications. And our focus is really to create high quality medical visualizations and expand this diverse representation in medical artwork. Since the beginning in Body Scientific, we've been advocating for our clients to include more diversity in publications. So we work with textbook publishers, and we're always asking them to include more diversity when possible in their publications. And that's definitely been increasing more and more over the last 10 years that we're finding. And we're slowly transforming patient education by creating more educational material that prioritizes diversity representation in there. When people see that they're included and represented, they become more open and receptive to absorbing that information, comprehending the information, and that's being presented to them. So it's really important to have this visual connection in your patient education materials. So we like to provide doctors with diverse educational resources to help improve patient engagement, education, and health outcomes. So as you can see here, we try to create a range, so that make it available for professionals to choose what's maybe best for their office, or just include a range as well. We're working on certain topics for like pediatrics and including some diversity in those. We're working on women healthcare series, including diversity in those, for patient education, and men's health series. So these are just some of the things that we're kind of working on right now at our company. So, and I just wanted to kind of just end off with, the power of an image can really change lives. And that's something that we're really passionate about and hoping to be more and more involved with, because by this image here is a snapshot that I took when I was at Africa Health for a conference down there. And these are all nursing students. And for the first time, they really like resonated with medical images, because they've never seen in all their studying so far Black people represented in medical art. And then when they were presented with that, they were just very excited to see this connection. And I could just imagine how it's translating into their passion for their work and moving forward in their careers. So, images definitely have a strong impact when it resonates with them. And that's something that's been missing specifically in the medical field, where there hasn't been a lot of diverse representation in medical images over the years. And yeah, and that's me real quick. So there's a quick representation for me, and I will just hand it over to Rob. How's that? Let me stop sharing the screen.
Okay, thank you so much. I'm really excited to be part of this conversation. I'm going to go ahead and share my screen as well. Looks good. Yes. Okay. So to start, I just wanted to share a little bit about sort of my own background following Marcelo's example. So I'm a white guy, cisgender, heterosexual man. I come from a middle-class background. I'm a U.S. citizen. I speak English and some Spanish and Swahili. I'm a parent. I'm an agnostic, though I was raised Catholic. And my academic background is in biological anthropology, specifically primate behavior and ecology. If you have heard of Jane Goodall, I worked at her site for a number of years and still am involved in some of that research. And I've taught biological anthropology and related undergraduate level courses at 4 colleges and universities across the US. And I've been working in public engagement with science for about 8 years. And most of that time was spent at the American Association for the Advancement of Science, or AAAS, in their Dialogue on Science, Ethics, and Religion program, which focuses on science engagement with faith communities. I joined my current program, which I'll talk about in a moment, in January of 2023. And I don't have a formal genetics or medical background. And I did want to make sure that I said that, because I think that's important in thinking about where I come from. However, what I do have is a lot of experience in facilitating constructive conversations about science across differences of perspective and worldview, including on potentially socially contested topics like human origins and evolution, and also dimensions of human difference like race, sex, and gender, in both university contexts and in public engagement contexts. And since 2022, I've also served as co-chair of the education committee of my home science society, the American Association of Biological Anthropologists. And you can check us out at that website. So today I'm here on behalf of Personal Genetics Education and Dialogue, which is a program based in the Department of Genetics at Harvard Medical School. And our mission is to raise awareness and inspire curiosity, dialogue, and reflection about genetics, empowering people with the knowledge and confidence to navigate an increasingly complex world. And our goal as a program is not to be advocates for genetics or to argue for or against particular approaches or perspectives on genetics applications, but to create or foster sharing and learning about science in context, encourage people to consider different points of view about scientific applications, and support people in lifelong science learning. And how do we do this in practice? Well, by creating resources for formal and informal educators, hosting workshops, webinars, and other convenings, and seeking out opportunities for collective sharing and learning with diverse segments of society. And this can include educators, policymakers, members of the film and entertainment industry, faith communities, religious leaders, and more. And you can check out our website, which has a lot of free resources, and I imagine we'll return to those in the conversation at pged.org. So I thought rather than focus on specifics, I wanted to focus on approach, because I think our approach as a program, which kind of aligns with my own personal approach as someone who's taught and done a lot of engagement, is I think a really healthy and good one to bring into conversations about race and medicine and other potentially challenging topics. So for PgED, whether we're fostering conversations at a community science festival or hosting a forum with a local faith community or leading a workshop for educators, these are some of the values we try to center. We try to be empowering, meaning that we believe people in communities should be active participants in shaping the role of genetics in our lives and society. And so we try to translate that into our work through learning, discussion, and focusing on agency in decision-making about genetics. We strive to be person-affirming, affirming the humanity of every person. We seek to make space for people to engage with different values, perspectives, and worldviews, and try to be guided by personal and cultural humility, vulnerability, and empathy. We strive to be accurate and authentic. Our work is grounded in science, but also recognizes that science is a process, not a body of facts. Science is a process with a social, cultural, and political context. We strive to understand it through that lens and to model transparency, openness, and curiosity. And finally, we try to be impactful. We strive to produce meaningful outcomes for people, community, and society at large. Now, formal education is one context for science learning. It's certainly not the only one. And I think there are many approaches to effective science learning. But here are two that I think are really important for this context and topic. So these are my big takeaways. First, I think it's really critical to understand science and medicine in context. As I just said, science is a cultural, social, and it occurs in a social, political, and cultural context. It has a history that informs how people understand science and inform ideas about, is science to be trusted? Are scientists to be trusted? That multidisciplinary approaches when exploring topics like race and medicine can be really valuable. Drawing on the social sciences, drawing on history can really help illustrate and inform and enrich people's understanding of some of these potentially challenging topics. Being really intentional in course content and approach. Which voices perhaps are you highlighting in readings, in syllabi, in case studies? What books might you be assigning for people to understand, ideas like health or health equity? Are marginalized voices part of your curricula, or voices from communities who have been harmed by science? Are they part of the conversation? Who are you spending time? Which communities, which perspectives, which voices are you spending time on? And then along with that, creating spaces for questions, discussion, and reflection. I think that people are going to be coming into these conversations, whether at whatever education level, we're talking maybe introductory level coursework or more advanced coursework. People are always going to be starting from different places in terms of what they know or what they think they know. That is just one element that makes engaging on potentially challenging topics more challenging. A way to navigate that really effectively is looking to set healthy community norms from the outset, model some of the values I've mentioned already: transparency, empathy, humility. Community norms can help establish sort of guidelines for enriching impactful discussion. And in particular, being mindful that for some topics related to health and medicine, and I say this as a white guy who is often finding myself learning about these things in real time, it's important to remember that what might be an academic or philosophical question for me, because it doesn't touch me directly, maybe an incredibly personal and real experience for someone from marginalized backgrounds, people from indigenous backgrounds, Black Americans, who are often often coming from communities who have experienced real harm from science and medicine, and questions about sort of, is racism in science a problem, is not an academic question for many people from those communities. So with that, I'll just close by saying there are lots of materials that exist out in the world that I think can help navigate these materials. Our website is one of them, but there are many others which I'll post in chat that I think have a lot of value and that I've learned from and continue to learn from to supplement what LabXchange has pulled together through their own program. And with that, I will stop talking, and thank you very much for your time.
Thanks so much, Rob. Jeanne, did you want to go next? Wonderful.
Okay, you can see my slides, right?
We see your desktop.
Hang on a sec. You'd think I would do this, yeah. Now?
Perfect.
Okay, so hi everyone, I'm Jeanne Chowning. I'm the Associate Vice President for Science Education at Fred Hutch. I use she, her pronouns. I also want to acknowledge my colleague Hanako Osuga, who's on this call, who was a essential collaborator and thought partner on some of the work that I'm going to be discussing. I'd like to welcome everyone here. It's amazing. We have people from all over the world. I'm really thrilled to share some of our resources with you. Just really briefly, Fred Hutch is a comprehensive cancer center in Seattle, Washington, with over 5,000 employees. We're known for our bone marrow transplantation and immunotherapy. We have over a dozen programs for students and teachers at the pre-baccalaureate level. We're connecting them to science and health research and careers, and our student programs focused on students furthest from opportunity and from marginalized communities. I'm going to be focusing on some of our curriculum resources, so this is kind of a practical way that you might be able to address some topics related to race and inequity in your classrooms if you're coming from a classroom space. And all of our resources are open access, and some of them are also being posted on LabXchange. And I'm going to just briefly tell you about a few and then dive deeply into one. So before I begin, though, I think as educators, and I'm not sure, maybe you could raise your hand if you are a high school or undergraduate educator, because as educators, I think we're uniquely qualified to talk about the issue of biological race, and especially to debunk the idea of racial genetic essentialism, that there's some kind of like uniform genetic difference that categorizes different races. And this is one way we can really make an impact as science educators. In keeping with what Rob said, it's really important too to continue our own work, and to we work with teachers, we do professional development, and those teachers we can't reach, we've created an online opportunity for teachers to reflect about their own positionality, and also to learn about how they might create some of the environments that Rob was also mentioning that facilitate good discussions. I think one of the most important reasons for the work that we do and addressing this topic is to counter the connection between genetic essentialism and the connection to racial hierarchies that are at the root of white supremacy. So the murderer in Buffalo who killed 10 people in a supermarket posted some genetic data that he misinterpreted that's being circulated in 4chan and other social media contexts that purports to show a genetic difference in races. And so, maybe in the Q&A, I can unpack some of that data for you if you're interested. But in our curriculum, we have a number of different topics that are at the intersection of biology, education, and justice. And one of those is the DNA exonerations, where we kind of flip what might be a traditional crime scene activity using DNA electrophoresis, and instead focus on the exonerating folks who've been wrongly convicted and what is contributing to those convictions, and what's at the root of some of the inequities that we see in the criminal legal system, especially in the US. We also have an intro to cancer unit that talks about some of the inequities in cancer treatment and outcomes, and including, for example, this reading about Black folks with cancer and their experience. And this has been something that students have really responded positively to, the chance to talk about these topics. But mostly I wanted to show you this race, racism, and genetics unit that we're kind of reworking now, but we'll draw on a lot of what is already existing in our reworking of it. And it's really divided into three different groups of kind of ideas. Race is a socio-political construct, and I use the word political because of the power dimensions of race. Race is not genetically meaningful, but can have biological impacts through racism. And so this sequence is designed for high school, but it's been used by undergrad. So I think you can modify it as well. We start with the importance of identity, and race is a very real thing, and especially important for identity, shared culture. If you don't know your ancestry, it might even become more important culturally. And we also help co-author a STEM teaching tool on attending to race and identity in science instruction with some resources there. But it's very important to acknowledge the role that race plays in identity, and we address that at the beginning. We also use some resources like this one is Allegories on Race and Racism from Dr. Kamara Jones, and connecting the idea of bias to structural racism, how they reinforce each other, and the differences between personally mediated, institutional, and internalized racism. She has a very nice allegory called The Gardener's Tale. It's also in print, and it's a great reading. And so students work through that. I love this quote from Dorothy Roberts that says, race itself is an invented political grouping. It's not a biological category that is politically charged. It's a political category that's been disguised as a biological one. So a lot of students will say, yeah, I know race is a social construct, but behind that, they might actually be thinking that the biological category of race has social meaning, rather that this has been something that has been constructed for particular purposes. And in the US, that construction really links to the tension between the founding of a country, values and liberty and freedom, and the racial inequities and genocides that are happening around that time. And how do you resolve those? Well, the way to resolve them is to somehow make people less than people and use science in that way. And so we have a long history of scientific racism, but what kind of underlies all of it is like taking, whether it's skulls or genetic data, and trying to say, there's something different between these groups and there's a hierarchy. And so people are trying to fit the scientific data into some preconceived notions. And what we do with the students is have them think about people who they're scientists and they either contribute to the idea of race as a biological category or genetic category, or use science to support oppression or exploitation, and justify it. On the other hand, I think it's also important to acknowledge folks who've been pushing back on this since the beginning. And we do that by introducing students to some people who have fought the ideas of racial genetic essentialism over time. And this continues to the present day. There's a pretty well-known study about white lay people and medical students who are still holding, all these are false ideas, but they're still holding them, and some of those are rooted in a long history of this kind of presenting difference and validating it scientifically. We use TikToks from Joelle Burville. Is a great resource for health inequity TikToks, and using also look at history and how history impacts current health inequities. So students apply what they've learned about the history to current issues, like why was it until just recently NFL players were compensated differently for brain injury based on race? It just changed. But why was that? We really try to disentangle race from ancestry. So students look at like famous people or actors, try to think about, well, okay, people might be racialized or even identify racially in the same way, but have really different backgrounds. And in terms of, let's say, Tracy Ellis Ross and Barack Obama, their African ancestors were really different parts of Africa, and their European ancestors were very different parts of Europe, right? But they get racialized or identify racially in the same way. So we can think of race as kind of like a blanket that's kind of covering or obscuring race. And so we talk about race as a poor proxy for ancestry. Students look at the census, and the census is a really interesting tool for kind of unpacking what's happened over time, and especially the political changes that cause some of these categories to morph. And you can really see the political impact of these categories over time, and how they change to reflect what's happening. We also see, like, even in genetically identical twins, they may be racialized differently. So we know that, you know, it's not race and ancestry or genetic background is not the same thing. I like this comment from Dawana Fulwiley, who's an anthropologist who's done a lot of work about race and science and how scientists use race in their research. But she says, like, I can take a plane trip in one day, I can be identified in 3 different ways: African American in the US, mixed in Europe, white in parts of Africa. So, you know, and again, showing that malleability of race. We connect the evolutionary basis of some traits to this idea of ancestry being important. And so students think about, okay, actually in these biogeographical regions, what kinds of traits might be selected for or more help survival, and also that different kinds of variations may happen so that there's convergent evolution. They might not exactly be from the same genetics cause. 2 areas where I think health educators really need to pay attention is genetic diseases and talking about skin color. So in genetic diseases like sickle cell, I think there's a tendency, and Brian Donovan's work shows this, to kind of you know, in textbooks, to lead the wording so that it seems like this is a like black trait or black, you know, disease, when in reality it's mapping to, as many of you know, the you know, frequency of malaria across the globe. So folks who are you know, identify as black potentially in South Africa don't have a high incidence of malaria, for example, where other regions of Europe and Mediterranean might have a high incidence. So of the sickle cell trait, because it is mapped more to the incidence of mosquitoes carrying malaria. And in skin color, I think we need to be especially careful, because if we teach about the genetics of skin color, and students know that race is largely based on physical characteristics like skin color when we construct the idea, then they may incorrectly assume genetics is underlying race, unless we're explicit about that. So they might take that away. And this is our diagram from before, sorry, where we actually talk about, okay, we take these observable traits and construct this idea. So we've kind of flipped that arrow from before. But many of you also know we're one of the most similar of all species, and we pay really close attention to this external part. But in reality, there's very little variation between humans, especially compared to other organisms. And the variation that does exist is pretty small. But we have an activity where students have cards and they're pictures of people. And on the back are 3 genetic variants. And so they organize the cards, by a grouping that makes sense to them, racial grouping, and then flip them over to see that within that grouping, there's a lot of variation. In fact, we know there's more variation between conventional racial groups than within conventional racial groups than between them. And this is a way to illustrate that. And so you can also go the other direction and have them organized by the genetic bands. Here we're looking at DNA variants in like the first position that's on these cards, and calling that the lactase persistence gene or allele. And then we see that the groupings do not correspond to race. And this could be reinforced by the idea that, white nationalists make a point of chugging milk to show that they, don't have the ability to digest lactose, that they do have the ability to digest lactose in milk as adults, a sign of their racial identity, whereas in reality, African pastoral populations also have this trait. And then we bring it around to health inequity and thinking about how this impacts health inequity. And in basically any kind of health inequity you can see with racial categories, there's different ways to explain this. So we use the example of Serena Williams and her experience in childbirth, but you could use just about any inequity. And so here, disparities in maternal mortality, you could explain it as a race-based misconception or a race-conscious explanation. So the race-based misconception would be an inaccurate explanation based on, ideas of race as biology, like Black women are just biologically more prone to maternal mortality. Or you could have a race-conscious explanation that takes into account some of the racist policies and practices that might influence these inequities. And, there are some genetic variants that map to ancestry that have health impacts, but a lot of the mortality disparity between Blacks and whites in the US has nothing to do with genes. And we kind of model how racism gets reinforced and ideas of race gets reinforced by thinking about the origin of the power and profit motives that drive a lot of racism, and then reinforce the idea of biological race through the process I just described. We end with student education campaigns, because one thing we learned is that students need to feel like they can make a difference and change this situation. And we also have some assessments built in. But I do think that as educators, we need to think about how students' ideas are influenced by genetics instruction, particularly, and how students can have opportunities to make sense of racialized stories and data and distinguish between those different kinds of explanations. And really understanding the history helps a lot, because you can talk about genetics and genetic similarities until you're blue in the face, but if you don't understand why the categories were formed in the first place and what purpose they served, then you're missing a big part of the equation. And then, our students are going to be the future scientists and doctors, and we have an opportunity as educators to be able to equip them with factual information about race and racial difference. So thank you for tagging along on that whirlwind tour of our race, racism, and genetics and some of our other curriculum. Here's the contact information, in which I'd love to follow up more with you afterwards.
Thank you so much. That was so wonderful. And I feel like a nice transition into what LabXchange is doing. So I will close us off to share a bit about LabXchange and what we have going on, and kind of the content can tie into some of these great pieces that we are already listened to. So I think many of you hopefully are familiar with LabXchange, but if you're not, welcome, and we're so delighted to have you here. So for those of you that don't know, LabXchange is a global science education platform, and we have some incredible content that we are creating, but also from great collaborators, as I've kind of noted in the chat. All these great folks have their content on LabXchange. But the intention, or the goal of the organization is really to make sure to give space and opportunity for everyone to learn and chart their meaningful path into science. And all of this is free, so anything that we've shared thus far, these are free resources that are available to you all. And so with that, this new initiative that we have going on at LabXchange is centered around racial diversity, equity, and inclusion in science education. For the future of the rest of my slides, I'll call it REDAISE, just because it's a bit of a mouthful. But this REDAISE project, or this initiative, was really founded and developed in collaboration with some amazing scholars in this field, perhaps some overlap there with Fred Hutch, to really think about the structures that perpetuate racial inequities within healthcare, education, and STEM. And so we really want folks to think about that, science is not independent of these issues, and how can we prepare and equip educators to bring these topics into the classroom. And so at LabXchange, with its project, we've got 2 different clusters or groupings of resources. The first of which is racism as a public health crisis. This is aimed at high school and college learners in particular, and this explores this concept of race through the lens of medicine and public health. So this one is fully out live now, so I'll kind of dive into that a bit more here today. But the second piece, which we're really excited is going to be actually launching this fall, is developed specifically for educators. So in essence, these resources that are in development now are to create inclusive spaces and to have educators feel empowered to have these kind of conversations. And all of these resources that I'm discussing here today are pretty modular. So you can really take and pick and choose really what might work best for you, and perhaps can work in collaboration with some of the great images Marcelo has, or Jeanne just shared, or perhaps with the PgED content as well. So with that, the learning pathways are the topics that we cover in that student-driven path or cluster, is how can we begin to understand race? How can we begin to understand human genetic diversity? So very similar here to perhaps some of the topics that we have heard thus far. Racism and the history of science, and I love that piece that Jeanne was just ending on, and that pathway in particular, it really dives into, again, the historical context to how a lot of certain decisions or perhaps things within medicine were created. What role should race have in medicine? What are health disparities and what causes them? And how racism influences social and environmental determinants of health, and then working towards health equity. So all of this content is interdisciplinary, it's inclusive, and it's interactive. And so when I say all of this, it's really with this intention in mind that we're creating these resources to allow students to feel inquisitive, to feel interested and engaged in a way that we're not excluding anyone in part of these conversations and part of this process. There's a few specific examples that I want to share, one of which I just described, which is the racism and the history of science pathway. So pathways on our platform, if you're not familiar, are sequences or playlists of resources that provide this guided journey, and they have specific learning objectives tied to them. They are a great place to use as is, or you can even modify them to what might work best for you in your classroom or whatever space that you're in. And it does provide this contextualization to these scientific discoveries and innovations. So pathways, this is one example. As I just shared, there's 7 different pathways, but this one in particular, I think, ties to those topics that we were just discussing previously. All right. Another example tying into that idea of interactivity of our content, we have developed what we call interactive infographics. So these are simulated environments that have these clickable interactive hotspots. So students or learners can explore at their own pace. They click through to learn something and then unlock a new scene. And I will say these are all mobile friendly as well. I'm not sure, I know we've got some folks that are pretty international, that students might not have their own computers. So all of this content is mobile friendly. And resources like this are incredible to integrate kind of pre or post conversation, thinking about ways that the role that race plays within medicine. So those are interactive infographics. And I just have one more example of content that I wanted to share, and that is a scrollable interactive. So a bit different, but once it opens up, folks are kind of scroll down at their own pace. again, controlling the speed, making sure that they are understanding what's going on at once. And it allows them to have this deeper understanding of how to potentially address these inequities. So this last example, why should we care about health equity, kind of dives into that. I didn't scroll through the whole thing on this screen grab, but you can only imagine what you might be looking for. Who said, could you show us by sharing your screen? I can in 1 second. I just want to make sure I answer all or go through all my slides here. In particular for course integration, thinking about health and medicine, I did want to pull out some specific topics that, all this content could tie into in terms of conversations, thinking about health disparities, working towards health inequity, policy interventions as well. And I did extract a few examples here. I'll put them in the chat as we kind of continue our conversations, thinking about what are these inequities, how can we underserve your communities? And then, oops, thinking about medicine, we also have thinking about standards and topics about practice, bioethics, pre-med, or even considerations for your own personal and medical care. So thinking about, how racialized medicine impacts health outcomes, the legacy of slavery within modern gynecology, and culturally competent care in action. So I will go back to showcase that scrollable interactive one more time, just as an example here. So it should be able to see when you click through. It's kind of hard to explain here, but folks can scroll through, and I'll put the links into the chat as well so that you could explore on your own time. But with that, I have my contact information here as well, and I'm delighted to continue to have this panel here with us this evening to answer questions that folks may or may not have. So are there any questions in the chat? Let me just see here. Are the materials on LabXchange CC BY? The content explicitly, the Reday's content itself is copyrighted to LabXchange, but there is some content that is CC BY on LabXchange. Great question. All right. Well, to kick us off, I brainstormed a couple questions to kind of get us going in our conversation here. One of the things that I have certainly encountered as I have talked to other educators is thinking about ways to have these kind of conversations with administration or perhaps other folks within the communities. What are some ways, asking our panelists here, that you've encountered or kind of thought about bringing these types of topics into the school, into leadership, and kind of any pushback that folks might receive?
You know what? I'll just kind of jump in. I mean, our company creates medical images. That's kind of our core business. We're very interested in as far as healthcare is concerned, medicine, trying to engage young people with medical images because they have not seen those medical images when they were younger. So it's having images that resonate with some of these younger folks as they start learning more about race and theory and things like that. When they start seeing some of these images, that we're hoping that is going to strike up conversations that they might have at home. They might just carry it subconsciously along as they go through their classes and during time, and hoping that those images would help in this discussion that will come as they learn more about race and are impacted by that.
I will say that this question probably comes up more than any other, especially as, the situations kind of swing back and forth in the US. And I had, I like this quote from from James Baldwin, which was from 1963, but I feel like is still applicable, from Talk to Teachers, that we must be prepared to go for broke when we're dealing with students, but also we're going to meet brutal and determined resistance often, because this is some of this information is really fighting some entrenched views of what racial categories mean and the hierarchies that are there. And so it's very hard for teachers. I've talked to a lot of them, but the things that seem to help is to have a supportive administration, and also to really, kind of link this to what actually happened in history and what our scientific information says, and the large scientific organizations, AAAS, American Medical Association, they all come down on this side of saying, like, no, this is not race is not genetically real, even though it has a lot health impacts through racism.
I would just really add very briefly to Marcelo's and Jeanne's great comments. I think coming with data as to why this matters, data on enrollment, being able to cite major science societies saying that this is a moral imperative, being able to point to funding agencies who are saying we need to see more research on this, we need to see more support for diversifying medical workforces, for all the very compelling reasons why that's critical. So I think there is a immense moral imperative, but I also think that administrators and institutions sometimes respond more to data and prestige and things like that, and try to leverage that if you can. And also I think giving space on a more human level, giving space for people to voice their concerns. I mean, it is a challenging moment to engage robustly and fearlessly with DEIA, particularly in some parts of the country where this can actually get people into legal trouble. And I think giving people administrators who are presumably human to share any concerns they have, and maybe there's ways to work within those concerns. But there is absolutely a moral imperative that we have to do better.
Absolutely. And I just to add to that, I think also tying into what maybe already exists at a school or within an organization. So it's not like you're trying to reinvent the wheel and bring something brand new. I think thinking about what could I tie into, and I love thinking about, is there a biology, anthropology? Are there other topics that I could weave this into in a natural way that ultimately would be successful? And that way it's not, again, something brand new. And I see, David, thank you so patiently with your hand raised virtually. David, could you introduce yourself and ask your question?
Sure. First of all, I just want to thank everybody for speaking today on this essential topic at a time in our history where our science has finally caught up with our moral values. We understand that race is just a bunch of garbage. But my name is David Upegui. I am a high school teacher in Central Falls, Rhode Island, which is the poorest school and the poorest city in the state of Rhode Island. I am a graduate of the school, and I went back to teach at my alma mater. I also have done some work in this topic, and I wrote a textbook, which was recently released, and I actually have done work with Brian Donovan and with Agustin Fuentes and Joseph Graves Jr., and several other folks that are actually included in my book. But this is not a plug for my book, right? What this is, I want to just mention one thing, and I want to share first this link. The first thing I wanted to tell you is that this stuff is not going away, right? There's these people who are out there and who are dynamically changing the way that they talk. So this was from The Atlantic. The person, my co-author, just sent me this link describing how the far right in the United States, how a whole political group of people are focusing on race and IQ. And the other thing I wanted to mention as part of my question, as a preface to my question, is that I just recently, a couple of years back, started using a curriculum that is quite popular. It's a very expensive curriculum. Our school started moving into CTE. And so I don't know if it's kosher to say the curriculum, so I'm not going to say it, but I just want to mention this. When I looked at the curriculum, there was this really upsetting approach, which was in light of what they thought was inclusion, what they've actually done is reinforce the notion that there are biological differences between groups of people in ways that break into these four lineal categories, right? So Linnaeus told us yellow, black, white, and red. And these idiots, because believe me, I have another term that I want to use, but really these idiots went and said, Juan comes from Mexico. And I'm like, okay, so what does one coming from Mexico have to, how does that inform me that what are his chances of getting or developing cancer? And then, Tanisha, who is black, and I was like, what the hell is this? And so I wrote to them and I specifically asked them, why would you put names like Juan or Carlos or whatever their name is? And how does that help the students to understand and explore the concepts of risk factors for cancer? And the answer was, well, we want to be inclusive of people. And I guess what I'm trying to convey to you is that it's easy for people to make the mistake of trying to be inclusive and not fully understanding that we are inadvertently reinforcing the idea that there really are these four categories of race and that they are meaningfully biologically distinct. And as soon as you make that assumption, then it's easy to make the assumption of these other people in the Atlantic, right, of these far right groups, which is, well, if there are differences between these races, then of course there are going to be differences in IQ, and therefore the social determinants of income and health and all these other things are just can be boiled down to the genetics rather than the structural deficiencies that we have created. And so I guess my question to all of you is, how do we address a moving target? Because these people that really want, they're ingrate racists, they just can't get out of their own way. They continue to shift. They're morphosizing. So ultimately, and I apologize for the long run, but what is it that is going to help us to address this moving target?
I feel like it's persistence. We just can't let up. There is as much information as they're going to put out that's misinformation, or not people that are trying to deliver the correct information, but still are not doing it correctly, like I think you're suggesting. It's everybody else has to be persistent. We have to keep teaching and proceeding and trying to go faster than the other side is delivering the information that they're delivering. I always think starting, the earlier we can start and educate everybody on these topics, the better we will have an older group of people having a clear understanding. When they hear this information, maybe they can decipher it on themselves. But I always think the young people, hopefully, depending on their family structures, I like to think that they're like blank slates, and they can be programmed one way or the other. And so hopefully we can, not so much want to use the word program, but let's say provide them the proper information that is correct. And then hopefully that will carry through. If it doesn't carry through in their families, maybe it'll carry through in their teachings in the right schools that they belong to.
Yeah, I would second that. And I think it's important also to help students. That's why we end on the kind of advocacy piece with students too, to kind of, because I think, we as adults need to advocate, but, we can also help with students learn how to advocate, because the way I think white supremacy works is part of the plan is to like tire out the other side, right? Like is to try to exhaust folks who are trying to shift that narrative. And so the persistence is important and not giving up. But there's like the patterns of how far-right folks take over school boards and work at that level kind of strategically. I think we also need to kind of think about how as educators we are working to think strategically about how we approach these issues at a larger scale.
Thank you. I echo everything that Marcelo and Jeanne has said, and I would just add also, I think that what the research suggests about science learning is that focusing on science as process and not focusing on learning facts, but learning about how is scientific knowledge generated can be really powerful in helping people navigate challenging issues. And you know, I look to like National Center for Science Education, a lot of work that's been done on like climate change education, evolution education. That is a really powerful approach, and I think has a lot of relevance here too. Like, where do these ideas come from? Tracing their history, exploring like, you know, guiding students and helping educators understand themselves, like, you know, how do we generate this information? What are potential sources of bias, the historical, social, political context? Like all that, what the data shows is that that is helpful in helping students, helping educators themselves engage with challenging topics. But, you know, there is really a moral imperative to do it. And you know, it's hard, it's challenging, it's the legal landscape, political landscape is making it worse. But you know, that's where we are.
One of our kind of assessments builds off of a kind of decision tree type of response chart. Like you hear someone say this, like, how would you respond? Like, ask them this question, you know, to try to help prepare students too when they hear something and they know it's not quite right, like how they can respond in the moment. And I think that's also kind of a powerful thing to help students figure out. With their knowledge of science and with their understanding of history, how they can help other students or adults understand the difference between race conscious and, you know, race-based medicine, for example.
And to add to that, I think it's really building that empathy and that awareness in students and having them be part in thinking about you know, how they want to be those advocates in this, as you said, against this moving target. I think to everyone's point here, I love the idea of starting with students, but I know certainly that there's a lot of pushback at the higher level political level as well. But I agree that I think this persistence and the passion that continues, and I'd like to think also is something that is I was gonna say like you know, you pass it on to others. I think passion and excitement and interest in race and advocating for a race and I should say that's the wrong phrasing. Advocating against race, excuse me, certainly would be incredibly valuable.
Can I say one more thing?
Oh,
I think
absolutely.
the community is important. Like we have to find people, you know, and this is why this is a nice convening, right? Like you have to find people who also kind of are working in directions and you know, we need to be together. And so thank you for convening us, but I think that's part of the solution too, is not just to work as individual actors, but kind of, you know, band together.
Absolutely. We're not siloed and by any means. We're here for these conversations. We have a couple minutes left to the top of the hour, and I want to be cognizant of everyone's time. Are there any other questions that we want to kind of dive into, or from the crowd here? Oh, I see one that just came in. There was a comment here from Shelley, and Shelley says, going back to what David said at my school, we were going to pilot, quote, sense of belonging project at our first years in our biology department. One of the things that the project does is help students give quotes from students of various backgrounds in the hope that our students can recognize themselves in the quotes and be encouraged. If it is not okay to say, quote, this quote is from Juan, or quote, this is from a Black student, how do we let our students see themselves in a quote so they know it wasn't from a rich, privileged white person? Is anyone familiar with the Sense of Belonging project? I know I'm not as familiar with this one.
I know that this is not my place, but I just want to mention that my issue was not so much that it was from Juan, is that somehow the students were supposed to make sense of Juan having some type of more likely, you know, a more,
Diabetes or something.
yeah, it was that. So it wasn't so much that, look, this is Juan. If the dude's name is Juan, man, call him Juan, Carlos, you know, Gabriel, whatever his name is. I don't have a problem with that. But my issue was not so much with the naming, but the connection. So when my students learn about diabetes, it's not a Black person's disorder, right? It's a poor person's disorder. It just happens to be that Black people are overrepresented in poverty. So to me, I wouldn't mind using names. I would just have a problem with like assigning characteristics, both biological and traits, to a person because of their name or their race.
All right. Well, as we kind of start to wrap up here, I just want to thank our panelists, and I want to ask them one last question, perhaps we could end on. And I will add, this is not certainly the end of this conversation. This conversation is ongoing, and we certainly welcome feedback and engagement through all these organizations. So certainly, I say we're wrapping it up. We're wrapping it up in this webinar here, but we hope that folks will be more involved and engaged with us at LabXchange and these other organizations as we continue to have and continue these conversations. So panelists, what is one final last piece of advice, topic, resources that you want to share with folks as they think about bringing the idea and concept of race into science conversations and into the classroom? And I'm kind of putting you on the spot here. One last piece of advice. Yes, Marcelo.
You know, in preparing for just to talk today and looking at information, and I looked at a lot of the information that you had posted. I shared that a lot and talked to a lot of other people. I think, I know Jeanne and Rob were both talking about this, but we have to. We can't do it alone. We have to talk to people and let other people see it, even people that understand, that this whole topic very well. Just even reading it gets them energized to then share it and expand this out, because the other side is doing it faster than we are. So we need to do our part. I think that's what I would say.
I would share on a hopeful note, and I think this is reinforced in sort of what's been shared at this panel. You do not have to do this alone. There is so much stuff out there in the world that is free, that is up to date, that scientists and educators and organizations are really, really doing their best to share draw on all the best evidence for science education pedagogy and best practices in science communication and up-to-date information. And it's out there, and like I think our challenge is finding it and disseminating it and making it possible for teachers to use it without exhausting themselves. And so that's, I think, just something to be hopeful about, that like it's out there. There's great videos, there's great books, there's great lesson plans, there's great interactive activities as Jeanne shared, and like the big challenge is moving to the doing. So
I just want to applaud everyone. Give yourself some credit for making time today to focus on this important topic. So I was really glad that you came. And I think it's good, and I say this to myself as much as anybody else, to continue to have the spirit of a learner. I'm always learning new things. I've stepped in it plenty of times. I'm just like trying to figure it out and to extend some grace to other people who are on their path of trying to figure stuff out if they're really, trying to understand and learn more. And so I think that would be something I would leave you with.
Wonderful. Thank you so much, panelists. My last moment is, keep on learning, check out LabXchange, check out all of our great collaborators that are on our platform. Keep on learning, keep on doing all the great things. I did put a pledge here. We're trying to get some, garner some community and some excited support to sign our pledge, and we'd love to follow up with you to continue these conversations. So with that, again want to thank our panelists. If you're still on this call, virtually or, however you want to give everyone a big round of applause, and enjoy the rest of your evening or afternoon. And we will see you at the next webinar. Perfect. Stop recording.